guys, it's Friday, so you know it's flashcard Friday. So we are just going to do a few flashcards based off of those STDs we covered this week, okay? So here on my flashcard, this one states it's an inflamed pelvis due to an infection to the female reproductive organs. Treatments are Ribsephin, doxycycline, or Flagyl. What do you think this is? Pelvic inflammatory disease, right? You know, we have that inflammation to the pelvis um, due to some type of infection, some type of bacteria, some type of something secondary, commonly to STDs, commonly like a gonorrhea, that can lead to that PID, that pelvic inflammation to those female reproductive organs. Next, warts on the genital region, common treatment, cryotherapy. And that's, short and sweet, genital warts, right? All right. All right. Few stages of this one. Their primary is those canker sores. Secondary, they'll have the rash on the palms of the hands and soles of their feet. And in the tertiary stage, they have those neuro deficits. And this one is treated with penicillin G. Syphilis, right? All right. They may present with yellow discharge, and very common one is a strawberry cervix. Treatment for this is Flagyl. Right? Trichomonas. Remember, trichomonas is that common thing is that strawberry cervix. They may have, excuse me, yellow discharge. We treat with Flagyl, and remembering that it looks like little swimmers, little fish under the microscope. All right, another one. They may have discharge that may be green, and they'll have cervical motion tenderness. Treatment options are Ribsephin, azithromycin, or doxycycline. Gonorrhea, right? Remembering, I'm going to show you the next one, and then we'll talk about that, okay? They'll present with some discharge potentially, and also have cervical motion tenderness. Treatment is azithromycin or doxycycline. What is this one? Chlamydia, right? So let's talk about that really quickly. Gonorrhea, chlamydia present commonly. Go ahead, test them for both. If positive for gonorrhea, as I told you on the video this week, if they're positive for gonorrhea, you want to go ahead and treat with that Ribsephin, aka ceftriaxone, giving them that 250 milligrams IM for that one-time dose. And then you can also pair it with that azithromycin to go ahead and co-treat for the chlamydia, right? They have similar presentations. Gonorrhea typically is going to have more of a greenish discharge, where chlamydia usually does not. And again, if in the alternate fashion and the swab comes back positive for chlamydia but negative for gonorrhea, just go ahead and treat with azithromycin for that chlamydia, okay? And remember, in pregnant women, we treat with azithromycin for chlamydia. All right, next. Commonly identified by a fishy odor. You will do the whiff test. That's where you can really identify that odor. Maybe clue cells when doing the microscope, and they may also have white discharge, or they may complain of that white discharge. Treatment, first line is Flagyl, and you can also treat with clindamycin. What you got? What you got? BP, right? Bacterial vaginosis. And then one more, and you should know this easily. Screening test is your ELISA or ELISA, and you confirm with the Western blot. Those are the odor tests, but I still like to tell you guys that we treat with antiretrovirals. Prophylactically we use Bactrim. And then this just kind of discuss those CD4 count for your knowledge base, but instantly you should think HIV, also known as what? The human immunodeficiency virus, right? No, it even broken down, because we so commonly say HIV. If you see it differently, I'm sure you'll be able to identify it, but I like to make sure y'all know that. But anyway, you guys, As always, like, comment, subscribe, share with a friend or colleague who may find this helpful as well. And meet me back here next week for some more tips and practice question and flashcards. All right, bye y'all.